Tonight, as the measles outbreak spreads, a growing number of cities and counties are taking action to prevent unvaccinated children from going into public or even going to school. An attorney who's been fighting some of those same bans, he'll join us tonight. Then former Congresswoman Liz Holtzman here to take a look at the Mueller probe. She on the House Judiciary Committee way back at Watergate. She's going to tell us what she saw then and now, and trust me, she holds nothing back. Also, ABC News political director Rick Klein, he'll join us weighing in on the growing number of Republicans who are getting upset with this White House. Good evening, everybody, and welcome to RFL. I'm Richard French, and we're going to start tonight with the measles outbreak. Now, I'm going to start with some jarring numbers. Centers for Disease Control say that we have seen more cases so far this year, and as you know, we're in early April, than we had in all of 2018. Take a look at this map. A disease that was once thought eradicated is now appearing in 19 states, and 3 places in our viewing area are dealing with outbreaks that, according, as I said, to the CDC. I'm talking about New York City, New Jersey, and Rockland County in New York's Hudson Valley. Now, the city's outbreak primarily centered in Brooklyn's ultra-Orthodox Jewish communities, and there is a misinformation campaign that is targeting that community and trying to scare parents away from getting shots for their kids. There's a pamphlet being circulated by a group called, who calling themselves Advocates for Children's Health, and it contains items like this, and you may have seen this in the Times. Vaccines contain monkey, rat, and pig DNA, as well as cow serum blood, all of which are forbidden for consumption according to kosher dietary law. Well, my next guest, he represented parents in Rockland County who have challenged the emergency order that has been put in place by the county exec there, barring unvaccinated children from indoor public spaces. A state judge sided with the parents and issued a preliminary injunction against that very order. And he's also challenged an order that banned unvaccinated kids from schools in Rockland County that had vaccinated rates considered too low. A federal judge ruling did not allow those kids back into school. Joining me now, attorney Michael Sussman and Andrew Whitman, our senior political correspondent, joins us, and he's been covering this story as well. Okay. Do you believe, on a broader question, that parents have an unalienable right to not vaccinate their children and potentially transmit a very dangerous disease to others?
What I believe is of little consequence. New York State has a religious exemption regime in place, as do 48 other states. 20 states allow people, regardless of whether it's based on religion, but simply philosophical beliefs, not to vaccinate children. New York has a measured system because in New York, if you have a school where there's 1 case of measles, those parents' view can be overridden, those who fail to vaccinate their children, and their children may be excluded from school. That's New York's regime at the current time. I think that's a measured approach that's sensible, yes.
Okay, on the religious objection, and please jump in where you like, exemption, excuse me. I was looking, and there is no formal religious law at all that bans this. And what I just mentioned there off the top, that's completely fallacious. It's completely not true about the items supposedly that are in the vaccination whatsoever. So I know there's a religious exemption, but where is a religious law that justifies it?
See, I think you're getting into a level of discourse that I entirely reject. I'm not interested in knowing about the details of your religion or anyone else's. It's like conscientious objection in the military. Is there a religion that says you don't fight? Is that the Jewish religion? I'm a CO. I didn't base it upon my Jewish religion. I based it upon my own religious beliefs. People are entitled to have a set of beliefs, for example, as some of these individuals do, that they don't want to put anything foreign in their children's body. Some of them believe, and I think there is some evidence for this, that some of these vaccines have parts, if you will, that come from aborted fetuses. And that's factual, not unfactual. Now, they don't want to put that in their child's body. I'm not second guessing that one way or the other. The way we do it in New York State, and there is a protocol in the state, is those people present their case to their school. And the school, public or private school, has to make a determination on the bona fides. Okay. That's the process. It's not up to Michael Sussman.
Okay. It might not be up to Michael Sussman, but obviously, nor to me, but with especially Passover coming up, the governor the mayor of New York City has real concerns. Let me say as to how far he's considering going here because of the health concerns of the unvaccinated.
We are declaring a public health emergency effective immediately. Department of Health will issue violations and fines to people who remain unvaccinated. Schools that do not actively participate in helping us address this issue, if they persist in allowing this danger to continue, we have the option of closing them for a period of time, because soon it will be Pesach. There'll be school vacation. There'll be more and more families together. The last thing we want to see is more family members afflicted by this disease.
And to supplement that, if I could, and then I want you to respond, you have major Orthodox leaders in Brooklyn right now that are encouraging Jews to get vaccinated, with some local yeshivas going as far as to say they will no longer accept unvaccinated students. The Mir Yeshiva in Jerusalem, the largest yeshiva in the world, told its rabbis and over 8,000 students to, quote unquote, immediately get a vaccine. So again, if the rationale for not getting vaccinated and to be able to have this exemption is a religious-based one, and you have the largest yeshiva in the world saying get vaccinated now, I just come back, Michael, to
I think you're being demagogic, frankly, and I'll explain how so. You can get a rabbi or an expert witness to say anything. For rabbis who take that position, I've talked to rabbis who say exactly the opposite. So I don't think you should herald one particular perspective that's offered by a rabbi or 10 rabbis compared to 5 other rabbis. I don't think that's the issue. I really don't. Look, New York State has a measured way of responding. What I didn't hear Mr. de Blasio say is, what I'm doing, which he has the authority to do squarely under New York State law, is quarantining those who have the disease and those who have intimate association with them. Mr. Day didn't do that in Rockland County. Mr. de Blasio is not doing that. The question is, given that New York State explicitly allows that, why aren't they doing that? See, what they are doing, to me, is very Trumpian in both cases. What they're doing is saying, we have a benevolent purpose. There are too many immigrants coming to the United States. We're going to get rid of asylum. Wrong.
Isn't excluding kids from a public school or from a school then sort of almost a reverse of that? Instead of quarantining students and forcing them to stay home, you're simply excluding them from particular areas during the course of the emergency.
You're excluding, when you say them, you're excluding healthy children
who have not been
who do not have the disease, you have no evidence are carriers of the disease simply by dint of the fact that they're not vaccinated. New York State does not contemplate that. That's the problem. It contemplates that in a limited circumstance, which I mentioned earlier, which is where the school they attend has a case on the theory that they might have been exposed to that case. But otherwise, New York State law does not contemplate what you're suggesting.
But the unvaccinated kids are the ones who are the potential transmitters of the disease if they pick it up and spread the virus to somebody else.
That's the reason why, as I said a moment ago, the balance struck in New York is that if you might have been exposed, which is a very loose standard, you can be excluded if you have that religious exemption. So there's a balance our legislature and our regulators have already struck. It's well different from the balance these folks are striking.
Okay, given that we've already established my demagogical standard here, I'm going to go even further, which is, and I don't blow sunshine, you're a very smart guy. There's one thing with saying, okay, I'm going to take a religious position for myself. These parents are making a decision for a minor that doesn't get to have this decision, and by the way, they're making decisions for other children, potentially, exposing them to something else. Why, on the face of that, is that not selfish by definition? You're making choices for other people that don't get to decide.
Parents make decisions for their children every day. You make decisions about what you feed your children, which may be healthy or unhealthy.
But I'm not imperiling other children, by the way. I'm making a decision in my household that now...
Wait a minute, hold on. Before we get into your imperiling other children, if you have a child and you're concerned about measles, get your child vaccinated. If the vaccination has efficacy, you've just protected your child. So this idea that I'm imperiling your child, to me, is nonsense.
Time out. Whoa, Michael. You and I got 2 infants. We both take them to the pediatrician. By definition, they got to wait a while here before, they don't get it when they're newborn.
Said 6 months.
Okay. So we got 2 3-month-old kids. I now got to worry as I bring my kid in here if your kid potentially has measles and my kid's going to... Before you even have a choice to vaccinate my child here. You're making decisions for me.
3-month children on either of ours are not going to be vaccinated because vaccinations, contrary to what Mr. de Blasio said 2 days ago, these are not supposed to be administered until between 15 and 18 months. His order the other day said 6 months. 6 months. If you're not vaccinated at 6 months and we find out, the order goes as far as to say we could vaccinate the child for you. There's no warrant for any of that. Here's the question, Richard, and I think it is an important issue. These matters should be decided by a legislature, not by an executive acting by fiat. We have a legislature, we have a regulatory system. They have long considered the issue of vaccinations, immunizations, religious exemptions, and they've come to certain conclusions. If you don't like the conclusions, or Andrew doesn't like the conclusions, hold on a minute, lobby them and get them changed. Don't rule by fiat or executive order.
But these are emergency orders in emergency situations. Ed Days in Rocklands was certainly an emergency order.
What did the judge say?
Responding to
What did the judge say about the emergency nature of it? Please. He said there are 4 active cases at a moment in a population of 350,000 people. That's not an emergency.
And while the legislature considers or hasn't had a chance to meet or act on this, and
why not? It's been going on since September. Wait a minute.
No.
No. It's been going on since September. And Ed Day has not convened the legislature to sit and meet and say, what should we do about it?
The state legislature is considering action right now.
What have they done? What have they done in the 6 months?
Nothing. But that you're
so don't talk to me.
No. But that's kind of the point. Because if the legislature is slow to act, there is an emergency that is imperiling kids' health.
That's the problem.
Wait a second, though, Michael. For one moment, let's stop and say, wait a second. You and I guarantee, have some of the same frustrations as putting the PG version on the word here about our current president. He doesn't accept fact, and he traffics in misinformation. What are we talking about here? Please, wait. Sure. You're not for a second going to tell me that the Centers for Disease Control, the American Health Association, the Association of Pediatrics, the Surgeon General, for crying out loud, and I can go through more alphabet soups here. We eradicated the disease in 2000. And now, because some people say we don't want to do it, even after the direction of the leadership of their particular faith, etc., we now have, in April, we're going to surpass the number we had of all of last year, and we're rationalizing that somehow, some way, this makes public health sense. I know your job is to argue on behalf of the objections of your particular clients, but this is crazy. It's against their own self-interest.
That's not how I really envision my job, okay? Because I took this on essentially volunteering. I'm not being paid by anyone for this, so I take full responsibility as opposed to what any of my clients might think or want. It's my responsibility as a constitutional lawyer to formulate my position. And I don't agree with you with regard to executive orders. I don't agree with you that this is a limited executive order. I don't agree at all. Ed Day had means, as I've explained in this interview before, to deal with this matter for a 6-month period. He used neither of the means that New York state law permits. The first means, as I explained, is quarantining affected people. The second is to look at schools where there is a case and to prevent children who are religiously exempted from going to those schools. He did neither. So if you're going to come to me and tell me there's a public health emergency that now requires extra legal behavior or an edict, you have to show me you've at least tried to use the law as it exists. That's what a nation of laws is. Whether it's Donald Trump, Bill de Blasio, or Ed Day. I don't care their name. I care about the rule of law, and it's not being abided. And no, I don't think it's an emergency of the sort you're saying. I understand there are 4 times as many.
What's the number? Wait, Michael. Yeah. Fair enough. Sure. What's your magic number that reaches an emergency?
Well, let me put it this way. 4 active cases in a population of 325,000 people would never be viewed that way.
But where's your trigger then?
I don't have to have a trigger. I have to tell you that epidemic means one thing. It means it means a rapidly spreading disease through a population. That's not what we have anywhere.
Why is active cases the number that you're focused on because the issue here is the virus and the transmission of the virus, which could then lead to active cases. You keep coming back to the small number, you say, of active cases, but focusing on that number takes your eye off of the possible transmission, which could then lead to more active cases.
Okay, I'm not trying to take anyone's eye off that. I'm suggesting that the appropriate public response, as permitted by our regulatory system, in place right now, you don't have to have any emergency edicts, is a quarantining of those affected and those in intimate association with them. If you've done that and it proves inefficacious, which we haven't done, then come back and say, let's see what else we can do. But since September 27th, when they found out about 7 people returning from Israel with cases in Rockland County, they didn't do that. Today, in Westchester County, there are supposedly 8 cases, 6 in one family, as I understand it. Okay? What you do under public health laws, you quarantine those individuals. You're not doing it, and instead, you're going after a whole school of people who are not themselves in any contact with that group.
You're talking about the process, maybe even fairly, is that the county executive in this case has or has not done. But in the main, we have a situation that everyone agrees is going from bad to worse. The World Health Organization said it is now in the top 10 health crises in this globally and projecting to get much worse before it gets better, this idea of unvaccinating kids. So I'll ask you a personal question. Sure. We're both parents. Did you vaccinate your kids?
I'm not getting into anything about my own children.
But your only point is you don't have to answer the question, but you're saying you did this pro bono, that you believe in the rights being abridged of your clients. What about the rights of everybody else who says I shouldn't have to worry in 2019 about contracting measles because parents aren't vaccinating their kids?
Look, the only group of individuals you can be reasonably speaking about are those individuals who are not vaccinated. Those people who are vaccinated, given that we have in our state a vaccination rate of over 94%, and we have varying theories about herd vaccination rates, those individuals who are vaccinated are quote unquote protected. That's why Merck is making all this money selling the vaccine, because it's an efficacious vaccine supposedly. And I'm not arguing that point at the moment. There's a time and place to argue your point about is anyone really in their right mind taking on all the interests who are propagating vaccines. That's a different issue we don't have to discuss right now. Let's assume it's a wonderful vaccine. Take the vaccine, give it to your child, and what are you worrying about? So you're talking about a very small sliver of people, and I don't know how many people there are, who can't be vaccinated.
Okay,
right?
I'm going to ask you before I run out of time, not about where this goes from here, but don't put a face to the voice, but in the conversations you have with the folks who have chosen not to vaccinate their children, is there any movement? Is there any conversation that can happen? Would there be, if directed by religious leadership, locally or otherwise, would minds change? Is it because the education campaign hasn't fully reached? I talked about this pamphlet with 40 pages of misinformation. If they got all the real facts, possibly, would some change their mind?
Maybe this will help you. Of the 34 people who I represented most recently in Rockland, one of them was an Orthodox Jew. 33 of them are not Jewish. So I understand the focus on the Orthodox Jewish community and how you framed that, and I understand what you're saying.
Oh, and I understand this is not strictly to this population by any means.
That's why. So when you're talking about that group of people, it's not what the rabbi is going to tell them. It has nothing to do with that. It has to do with their sincerely held belief, which I understand you may find incredulous. I understand you don't get it. I get it. You don't share their belief. Fine. That's a strongly held belief that they have. And will anything change it? I don't think a rabbi will change it. I don't think a pastor will change it. And I certainly don't think that people who are acting outside the law, who've not used the law as it exists to extirpate the problem, is going to change it.
To be continued. Michael, always entertaining you
and
as
I
well.
apologize to you.
Don't.
You're not a demagogue. You were being for a moment.
Oh, I've been called much worse than that. All right, we are going to take a break. Andrew and I will be back. More fallout over the Attorney General of the U.S. saying the Trump campaign was spied on. Critics say William Barr protecting the president instead of doing his job and acting transparent when it comes to the Mueller report. My next guest, she's one of those critics, maybe one of the most vocal. Liz Holtzman joins us after the break, the former New York Congresswoman. As I said, she was there during Watergate in the Judiciary Committee. She's got a lot to say.